Hello everyone, I'm truly delighted to be here and able to talk about our research focusing on eye in MS. We are from Belfast, and I think Michelle done a fantastic job showing you the importance of eye research in MS. I don't want to repeat what she was already saying, so I'm just going to further emphasize that we need to be able to detect subtle changes that may mirror the progression of the disease, independent from optic neuritis, independent from relapses. And so the BEAM study, which we designed in Belfast, does exactly this. So what we try to do in the Belfast study, Belfast Eye and multiple sclerosis study, is looking at the feasibility and utility of different novel high-resolution eye imaging modalities in detecting subtle changes, and then to use these subtle changes to monitor and even predict the disease progression. Don't like to show tables, but those are boring, but just to show you the cohort characteristics, we have 16 MS patients and 25 controls in the BEAM study. There were no age or sex differences. When we focus on the MS cohort, we have 13 relapsing-remitting MS and only 3 secondary progressive MS. And you can see also the disease duration, you can see the EDSS diagnosis and the progression of the disease since diagnosis. And then because we are interested in the eye, we wanted to know the history of optic neuritis as well. So what you can see here in the total MS cohort, we had about 1/3 of the eyes affected by optic neuritis. And it's pretty much true for the subtypes as well. On this photo on the left, you can see the back of the eye. This is the optic disc. This is the part when the brain and the eye is connected. And when you generate an optical cross-section of this part, which is really easy, an imaging technology called by optical coherence tomography, you can start seeing the nerve fibers that leaves the eye, carrying the visual information and forms the optic nerve. Now, these are the nerves that are affected by optic neuritis, the major inflammatory event. And it's not surprising that it causes symptoms, visual symptoms to patients. And what happens after this major inflammatory event, the retina left degenerated. So some of the fibers there's a loss to some of the fibers, which we can measure with this technique. And so in eyes, history of optic neuritis, we measure thinner retina, which indicates neurodegeneration. But what we were interested in the BEAM study is beyond that, subtle changes that may reflect the progression of the disease. And so we know from the literature that about between 30 and 70% of people with MS experience optic neuritis during their life. But from postmortem studies, what they told us is that actually the optic nerve is affected in about 99% of the samples. So there's much more what we can see through imaging. So this is why we turn to high-resolution novel imaging modalities. And one of these were the so-called adaptive optics. This was designed for researching, for space research, and basically it removes atmospheric turbulence, and with that improves image quality. And with this technology in eye imaging, we could resolve single cells in the back of the eye. This was only possible in the lab before just under microscope. So these cells are in the outer retina, and these are the photoreceptor cells. In fact, these are the cells that senses the light. And so when we counted these cells, we measured their density we find that MS eyes all showed a reduced number of these cells, so reduced cone density. These are cone photoreceptor densities, which is interesting. So this is not dependent from optic neuritis, independent from it, and it may actually reflect some sort of background disease activity or disease progression, which otherwise not seen. And when we looked at how this relates to cone density or photoreceptor density relates to disease duration, we find that a lower number of cones are associated to faster disease progression, longer disease duration, which further strengthen the connection between MS and our finding. Now you can see that the samples are rather modest sample size, so this needs to be repeated, but definitely something we want to follow up on. We're not only able to image cells, but we can also image molecules. And in this case, we looked at carotenoid levels. These are antioxidant, and they are sitting just above the photoreceptors, and they are there to protect them from sunlight-caused damage. And so why it is interesting for us is because these molecules are also present in the brain. And in fact, they are linked to normal cognition, so important for normal cognition. And lower level of these carotenoids linked to slower processing speed in MS. And what we find in the BEAM study is that we did measure lower carotenoid levels, but only in those eyes. So the red would represent the eyes that experienced optic neuritis. So only those eyes we did see the reduced carotenoid levels in that experienced optic neuritis. So this measure might not be good for reliably follow disease progression, but that might be good to measure carotenoid levels. And then another big topic is changes to the blood vessels. So it's really little known. It's probably because it's difficult to image the blood vessels in the brain, and it's invasive. But we mostly know from postmortem studies that there might be some changes to the blood vessels as well in the brain that may contribute to the disease progression. And so in the eye, we can easily image the blood vessels in the retina, and they may actually reflect changes to the brain. And we use the novel imaging modality called ultraviolet field imaging. We can capture the entire retina, and we also used a technology called OCT angiography. That's again non-invasive. It's very quick, and it visualizes the tiniest blood vessels in the retina, the microcapillaries. We can measure densities. So what we did then is we looked at central retinal vascular changes. And we find reduced vessel caliber, reduced venule vessel caliber associated to MS compared to controls. And we find a sparser retinal vascular tree applies to venules in the central retina in MS compared to controls. And so, in fact, these changes been shown in other neurodegenerative conditions, such as Alzheimer's disease as well. When we looked at the peripheral retina, we didn't see differences between MS and control eyes. And when we looked at the effect of optic neuritis, we again did not see any difference. So it looks like that the peripheral retinal vasculature is not affected, at least in our cohort. Then if we go back just for a second to the central retina, when we looked at the retinal vascular parameters relationship to disease progression measured in EDSS, we find that there was a lower, so reduced vessel caliber associated with MS, wider vessel caliber is associated to greater disease progression, which is interesting. And then the other one is that a greater vascular complexity associated to, again, greater disease progression, which we want to follow up on. Again, this is a model sample size, rather modest, but interesting. And when we looked at the density of retinal vasculature, we found no differences between control and MS. But when we looked at the effect of optic neuritis, we did see a rather profound effect of optic neuritis on density. So there was a reduced vascular density that may indicate neurovascular degeneration in MS. But again, only those eyes we did see this that experienced optic neuritis. So this might not reflect reliably disease progression. And then, so just to summarize, what we've found so far is that we not only proved the feasibility of the different novel eye imaging modalities, but also could detect subtle changes that may reflect disease activity independent for relapses or optic neuritis. And what we want to do is focus on exactly those changes that are independent from optic neuritis in the future. And we also want to focus on those changes that are associated to disease duration or progression of the disease. And so how we're going to take this further? In terms of the BIMS, we inviting back our BIMS participants for a follow-up study. We want to see that's going to happen in the autumn. We want to see whether these changes progressed, how they progressed, and that may reverse some causal relationships. And we're recruiting some new participants to the BIM study in order to increase our sample size. So that would make our results more robust. And if you scan this QR code, you can find out more and find contact details where you can sign up for the study. And then in terms of the OCTOPUS, Michelle already talked about it. There's no eye component originally. We bring in the eye component, and what we learned from the BEAM study, we designed a high-resolution retinal image toolkit we developed with the advanced image analysis pipeline. So we're going to use this knowledge in the OCTOPUS trial and combine our finding, so the eye imaging with neuroimaging and clinical biomarkers. And all this to better understand neurodegeneration in MS and to, eventually to help developing effective treatments. And thank you very much for your attention.